Desi Fleming, are you virtual today or? Oh, there we go.
I am.
You're up. COVID-19 update.
Great, thank you. Good evening, Mayor and Commissioners. Today's COVID results have Cass County at 276 active cases, which has more than doubled since our last meeting. The 14-day rolling average positivity rate is 5.76% in Cass County and 3.1% for North Dakota. Currently, there are 19 individuals hospitalized across the state. Deaths in Cass County remain at 196. Through surveillance, 7 individuals with the UK variant strain and 4 individuals with the California variant strains have been identified within the state. Although testing numbers have significantly decreased, they have remained fairly steady since mid-January. The Center for Medicare and Medicaid Services has updated the status for Cass County from green to yellow, which will now require skilled nursing facilities to test weekly for the next 3 weeks or till positivity begins to decline. This color designation is different from the state's risk category designation and refers specifically to long-term care. As a reminder, our COVID testing location has changed to the strip mall at 3051 25th Street South. Rapid tests are available to the general public Monday through Friday, along with other priority group testing. Commissioner Preston did ask that I review the metrics set forth by the physician panel for the Red River Valley Task Force when reviewing the mask mandate expiration. Those metrics include a 14-day rolling average positivity rate consistently less than 3%, vaccinations offered through the 1B priority group, and no widely circulating variant strains that are not responding to vaccine. Currently, we are meeting 2 of the 3 metrics. The increasing positivity rate has raised concerns within the physician groups, with feelings that letting the mask mandate lapse tonight may be somewhat premature. Fargo Cass Public Health remains very busy with our vaccination efforts. As of Sunday, there have been just under 76,000 vaccines given in Cass County, representing a 37.39% first dose coverage rate overall. Fargo Cass Public Health has given 26,000 of that total. We are working in the 1C priority group, which is essential workers, and also encourage any 1A or 1B individuals that haven't previously been vaccinated to sign up as well. The state put out a press release last Friday that on March 29th, phase 2 vaccinations will be offered to anyone 16 and over. Fargo Cass Public Health is also on course at this time to meet that time frame as well. And in addition, we'll continue to prioritize those individuals in the phase 1 groups. Our process is going well, and I'm very proud of the efforts of staff with our mass clinics and other ongoing pandemic response activities. It's our hope that all will consider vaccination if they are able, so that we can continue to make positive strides towards higher immunity. And I can answer any questions anyone has. Thank you.
Any questions by the commissioners? Commissioner Preston?
Yeah, Desi, can you give us a sense of the vaccination rates of the higher priority categories? You, I think, did that for me about a week ago, but could you give us an update? Or
yeah, so I think the state sends out estimations, and they're based on, one is based on census data, one is based on the immunization reporting system. So in the 75 plus, I believe it's like 69 to 75%, and similar then in up through the 64. The lower age category probably is, I think that's more around like the 30%, so it's a little bit lower in that group. But we've done well in some groups, and then we still need to do some work in others.
Any other questions? Commissioner Strand?
Thank you. Desi, I'm just curious and I'm concerned when we lift the mandate, or the mandate across the state and other mitigations are lessening. Then I look outside downtown. We had hundreds and hundreds and hundreds and hundreds of people bar crawling a week ago Saturday night. And I understand the desire to get out. Then we had a St. Patty's Day event itself, and then we had a parade with who knows how many people gathering. And then we had a whole nother night of bar crawling this last Saturday night. And I understand completely, but you help me understand the risk that is associated with this type of an opening and activity stepping up, or is it not a risk?
Well, I think we're seeing, obviously cases in our area. We've had sporting events, the larger sporting events, the basketball tournaments, things like that, where masking wasn't very prevalent in those crowds. So we've definitely had some cases from that. We've had cases from travel, and then we're still having community spread. So, you know, under the green recommendations, masking is still required for being in those public spaces when we can't physically distance. So our message from public health is not going to change. Masking is still a huge part of where we're at right now, especially with our numbers going up.
Commissioner Strand?
For the sake of discussion, I'm offering a motion. I move that what was previously a mask mandate be changed to mask guidelines and be extended 2 more weeks through April 5th.
Is there a second?
I'll second it.
And John, there's no consequences or anything, it's just basically a recommendation.
It's a recommendation, Mayor, and I think that we had the right reasons for our recommendations in the past. I understand the public desire to minimize the enforceability aspects of this. However, I don't want to abandon the higher value of trying to keep as many people as safe as possible and having that expectation very clearly to the public. There's also many businesses I'm hearing from people on all sides. I'm sure you all are too. There's businesses, however, who would really appreciate us continuing a little further so that it's not all on their shoulders when they meet somebody at their door and have to deal with this consequence of somebody saying, well, and being confrontational about it. So my sense is if we could do like West Fargo, change it to guidelines, continue forward while we're also minimizing the enforceability aspects of it. So we're giving a lot more leniency, but keep the standard clear.
But didn't the West Fargo go off tonight as well? Doesn't their quit on the 22nd, even their guideline?
Yes. And again, I'm not on their commission.
No, I just,
Yeah, but
for
this is,
public information, I believe they're tapped to our mandate.
and I understand people want this done, but it's my best judgment to try keep going a little bit further while the vaccinations are going on and while we're still gauging the impacts of variants in our community.
Any other
Mr. Chairman,
discussion?
if I could
Mr.
say
Preston?
I would certainly support this. I think in starting to pull back from the mask mandate, we still need to be clearly telling people it's best if you wear a mask because we're not beyond this yet. So, you know, having guidelines in place like this, I think would be a good kind of compromise of sorts.
Mr. Gary?
I think we lose a lot of credibility when we mandate things that aren't required. Whether you call it a mandate or a suggestion or something, everyone's going to assume it's a mandate, just like it always has been. So we have the numbers that we need. We're much better off than we were just a couple months ago. The numbers are way down. We told the public that this was going away tonight. They all expect that to happen. And now we're just changing the name of things. So I think we're losing credibility if we don't take it off tonight.
No clap. You'll be asked to leave. You'll leave. Okay.
Mr. Chairman?
Mr. Preston?
So I think we need to be clear that the numbers are actually going up in this last week. So it's not that they're so low and that we're out and safe. It's not. They have been going up in the 50s and yeah, the positivity rate's going up, so it's still a concern. And I think we just need to make sure we're sending that message. Be careful. Continue with the mask if you can.
Our last death in Cass County from COVID was February 24th. We have not had a death since that time. We are now vaccinated almost at least one dose, 50% in the community. The other issue we have is we have better treatment for the COVID. We have less people in the ICU. And with giving them monoclonal therapy, once they're positive with COVID, it had a tremendous change in the death rate. We have vaccinated, Desi's group and every group has almost vaccinated every vulnerable or high-risk patient in the county and has continued to do that, offered it to them, and we'll be through 1C at the end of this week. On April 1st, we're going to open up all vaccines to everybody in the community, and that should change to that area. I think we can simply request people wear masks, but I've seen a lot of non-compliance right now, and we want people to believe when you say mask mandate, you need it. And Commissioner Strand, you and I talked about this, is that when we need it, we need people to do that. And when we saw people wear their masks, their counts went down. Grafton just had a basketball tournament and their numbers jumped because people, you could see them, they were in the stands, no mask, and they were close, so social distancing was lost. We're seeing a jump, but we're jumping from a 2% to a 4%. We're not jumping to 20%. Concur with our concerns at the desk here that we're very concerned about that. But I hear a lot of feedback in the community that they would like the word mandate to go away and would like to trust the responsibility of individuals to wear the mask in public spaces and to honor any businesses' request that they wear a mask as well. So I'm concerned, but I think it's more important to end the mask mandate tonight. So that's just my opinion. But any other discussion? Commissioner Pipcorn.
So, Mr. Chair, I totally agree with what you said, and I think we should encourage people, especially if you're working at nursing homes, if you have people, if you're in a high-risk category or around them, wear a mask. I think we should, as a group, encourage wearing a mask, social distancing, washing your hands, all that stuff. We should encourage that and continue to do that without question. And also vaccination, that's what we should be doing. But this is freedom. And you got to let people have their freedom, and that's the thing we have to go back to. I'll give you an example. At the grocery store, I'll continue to wear a mask when I go in there. If I don't wear a mask, then I don't go into the grocery store. But I think people, we can all do it. We can do it. And so, but the whole making a law, that we got to move on, because the secret is it's never going to be safe. I said that a year ago. It's never going to be safe, and so you got to go on and live your life, and we're right on the edge of beating this, and so let's do it. But keep wearing a mask. That's especially when you're in contact. I think, Mayor, you talked about high population areas like City Hall, like a basketball game or a football game. Wear a mask. That's be a good neighbor, right? All right, thank you. That's my comments.
Commissioner Strand.
Thank you, and Commissioner Pepcorn, I really appreciate that sentiment, and I think it's right on the money. Here's where I'll leave it. Going forward, if we have another surge, if we have another spike in numbers, if we see what's happening in Europe, if we see this happening here, I'm forewarning you all, this is back on the table because we haven't nipped it in the bud. And I hope we have, find some wood to knock on, but I hope we have turned that corner. However, it's important for the public to know that we're gauging this. We're still not certain the best action going forward. I'm okay with lifting this mandate, and I'm very okay with it now. However, I'm hoping it's not a misstep, because that's on us.
And I would say we have the flexibility 2 weeks to come back to this issue, Commissioner Strand, as you had stated. So I'm learning game of that. Any other discussion? Roll call vote on the motion.
Strand,
Yes.
Preston,
Yes.
Gary,
No.
Pepcorn,
No.
Mahoney.
No. Drought status up.